leg face upward. Okay. My hand might be a bit cold. Yes, it's not Panama or Spain here. Cold outside. My hand's cold. It's Canada. Sorry if my hand's cold, okay? Okay. First mistake that the students make. They don't hold the patient correctly. If you can see the patient's ears, means you are not holding the patient correctly. A lot of time I see the students hold the head like this at the bottom. This is very hard for you to do the movement if you're holding like this. It's just very awkward. You have to hold like this. By the way I am holding, I can see her ears, and I cannot see, you cannot see which side I'm going to do treatment. If you see which side you're going to do treatment, means you're not holding correctly. If I'm holding like this, this means it's not the correct way, because you know I'm going to do the right side. You have to understand then it's not, you're not doing it correctly. So this is the first mistake the students make. The second mistake is they don't flex the neck. They don't flex the whole thing. The first step is to forward flexion. They hold like this and they start to do treatment from here. This is neutral position, not the forward flexion. This is forward flexion. Okay? So make sure you follow that. If you don't do this part in a forward flexion, all your technique, the rest will be useless too, because you can't lock. Okay. Second, they sit here and do the technique, but you have to, after the forward flexion, you have to move 45 degrees. If I try to do here, it's very hard. It's very hard. You cannot really use the axis of force, the vector of force correctly. So you can use this type of chair, or you can stand. I always recommend to students to stand because it's easier, but later on you can use the chair. See, when I do, I move here. That's how I do. 45 degrees. So after flexion, when you want to do lateral flexion, I move 45 degrees. That's one mistake students do. Now, the number one most mistakes the student makes, and which makes this technique very hard for them, is the lateral flexion part. It's the lateral flexion of the head, not the neck. This is what the students make mistake. This is the lateral flexion of the neck. This is what the students do. But this is lateral flexion of the head. You see the difference? This is, if you lateral flex the head, the neck, but not the head, you don't lock the joints, and then you don't do the technique. And then you see your hands go, keep going, and so after forward flexion, lateral flexion, while you do 45 degrees at the same time. You see, I'm not doing this. This is what the students do. This is, you see how much her neck is moving? It shouldn't be. Look at how much the head is making flexion. Very minimal. Now I'm locked. If you don't feel the locked in lateral flexion, your technique will not work. See, lateral flexion of the neck, I can go more, and until my hand stop here, I can still go more, because it's muscle going all the way. But lateral flexion, this is the end. I can't go any more than that. So this is the biggest mistake students make. Make sure you laterally flex the head, not the neck, okay? After that, the mistake students make, which is rotation. So forward flexion, lateral flexion of the head, then rotation. They rotate fully on the side. Well, this is not fully on the side 90 degree. It's 45-degree angle. So if you, the nose should face that way, not this way. So it is not full rotation. The students do like this, full rotation. This rotation is, you can't lock it. The correct rotation is like this. You see? Just like this. A little bit. You see my movement, how small it is? It's not like this. Just a little bit. So I'll show again. Forward flexion, lateral flexion, and rotation. You see how much I moved? Maybe 1 centimeter, 2 centimeter, 1 inch, 2 inch. That's it. It's not this. Okay? So to do it in a normal speed, like this. Then you come back next step.
What is your landmark on the TVP?
TVP, yes, on the lateral TVP.
There is pressure on the TVP, that 45 degree, but that was the big question.
It's not so much pressure. It's just like, sorry, posterior part of TVP, not lateral. On the posterior part of TVP, but it's not like really pressure that I'm pushing up. It's just more like a guiding. It's more like a guiding.
You're using your indicator?
Yes,
Okay.
yes. This one on the ipsilateral posterior part of TVP, I take the skin slack out. This one on the mandible, forward flex, lateral flex, and rotate. So once again, forward flex, lateral flex, rotation. And it's movement like this.
It's just the same for the upper and the lower cervical.
Hmm?
It's just the same for the upper and the lower cervical.
Yes, yes,
You have to forward flex fully.
yes, forward flex.
Now, if you're working on C5-6
Yeah.
and you want to lock the neck down to C6, right? So you fully flex the cervical spine. Then how far do you side bend it to flex it, to lock it down to C6?
Until you
Until it's
feel
locked.
locked.
Until you feel locked
In
to C6.
every moment, yes, sometimes you have to forward flex more, sometimes less, you can get it. But
Until you feel the moment to C6,
Yes.
right?
yes,
Okay.
but you like this is when you go low.
So
You just
you
go
side
until
bend
you-
the head,
Yes.
the upper cervical, and then you fall down until you feel the C6.
Until, sorry, I didn't understand.
So you side bend all the way down to C6 level, right?
Specific.
Side bend, what do you mean by that?
Lateral
Lateral flex, no.
How do you lock it
No,
down to C6?
lateral flex, you just move it until it's locked.
Okay.
You just move it until you feel it doesn't go.
Okay.
So you don't go based on every angle. Your finger is on the TVP, you forward flex, and then you just lateral flex until you get locked. You see, like,
The upper cervical is locked.
she's not locked, I can't push her anymore. So there's no even thinking about it. Whatever she goes, I lock it and then I rotate. And then you hold there 2 to 5 seconds, but in cervical spine, I usually prefer not to hold too long because you can block the artery and the veins there, blood flow. Patient might feel a little bit dizzy. Yeah, in lumbar, I told you to hold 5 seconds because it calms the patient. Cervical, I do it usually 2 or 3 seconds. I don't want to wait too long there because of blood flow makes patient dizzy, and then they feel worried that you're doing something that might damage them. So I don't hold too long. Any other questions? So practice this now. I know you were doing sacrum, but I want to see how you practice. Thank you very much for volunteering.